Hello and welcome to today's episode, Building Bridges, Stakeholder Identification and Community Engagement. Health HIV's DC Engage program aims to strengthen the capacity of aspiring or established community-based organizations and peer-led coalitions to integrate culturally and linguistically appropriate, evidence-based, and promising practice models to prevent opioid overdoses, enhance access to prevention and treatment, and to reduce deaths associated with opioid use. This program is funded wholly or in part by the government of the District of Columbia DC Health, HIV/AIDS, Hepatitis, STD, and TB Administration, or HOSTA. Kenya is a long-standing advocate for social justice, health equity, HIV prevention, and community empowerment, bringing over 2 decades of experience addressing health disparities and uplifting communities. In this episode, we'll explore the importance of identifying key stakeholders, building meaningful and mutually beneficial partnerships, and strengthening collaboration to create stronger community impact. We'll also discuss practical strategies for communication, engagement, and fostering lasting relationships that support the communities we serve. Whether you're a public health professional, community leader, or someone passionate about strengthening community connections, we invite you to listen, learn, and take these insights into your work. Let's get started. Why is stakeholder engagement important when addressing substance use and drug user health initiatives?
Engaging a diverse range of stakeholders, you can create a holistic, what I call wraparound approach that takes into account all the perspectives, like I just mentioned. Building trust and reducing stigma. And I think a lot of times we don't realize the stigma that as community engagers that we convey when we're having conversations. Sometimes it's based in implicit bias, right? We have it with HIV, we have it with substance use. We have a lot of different spaces where stigma sometimes appears, but we don't realize it. So it's always very important to understand your own biases so that you can help someone else. And combining these things, right, increase the likelihood of a successful program implementation and sustainability.
What does effective community engagement actually look like?
You could do things like host town halls, focus groups, surveys, outreaching through these organizations I mentioned, recovery groups, right? Peer support groups, advisory boards, training opportunities, such as what DC Engage offers through Health HIV, funding opportunities, TA, collaborative program development, and government agencies, and try to be involved in these spaces. It's very important for us to be involved in these spaces where we're talking about policies and sharing data and partnerships. It's very important that we do this not just with community-based organizations, but we engage our government agencies as well, because they are the ones that write and create and distribute these policies that can affect our work. So it's very important that we're part of these conversations.
What makes a successful partnership with community stakeholders?
Let's sit down, Sharon, and have a conversation. I'm just using your name as an example. Let's sit down and have a conversation and make sure our goals align, right? Our missions align. I think that's something important that's usually overlooked when folks talk about collaborations and we try to fit like a circle in a square, right? Let's make sure that we have these conversations, right? Make sure our missions align. And then have the uncomfortable conversation about resources, right? I may not have, the resources to this big project. You may not have that, but let's figure out how we can communicate with each other and develop a plan so we can share resources. So instead of me taking my $5,000 and you taking your $5,000 and do something completely different at two opposite ends of the district, we can combine to come together and it creates one great program for $10,000 that can really benefit members of the community.
What are important steps people should not miss when starting community projects?
One, having a clear understanding of the community you're trying to reach, right? DC residents are not a monolith. We are very diverse. You have everything from youth to aging, trans, queer. You have a variety of people, right? Understanding that your organization, your message may not be appropriate for everyone, right? Not saying you can't do the work with that group, right? But understand that yours may not be it. So that at that point, that's when that collaboration comes in, right? If your organization works well with seniors and my organization works well with the LGBTQ community, how can we combine forces and get some of your aging messaging to the LGBT community, and we can get the LGBTQ messages that we have to some of your aging community, right? So we could create some sort of an overlap. Um, is a major thing. Really sitting down and talking about making sure that we are selecting the right people and we're delivering the right message. What we've known, most of my as you read in my bio, experience has been around HIV, right? That's what I did, been doing that for a number of years. And what we know is that the cookie cutter approach does not work, right? The one size fit all approach does not work. We know that now. So how can you tailor your messaging to really affect that community?
If listeners leave with one takeaway, what should it be?
Identifying your biases, and it's not a bad thing, right? Identifying your biases, because implicit bias shows up and we don't even realize it, and we turn more people away than we bring in. Identify that. There's a number of workshops that's done it. There's a Harvard study. I don't remember the name of it off the top of my head, but there's a Harvard study. If you type in Harvard on implicit bias, there's a little thing you put on. It's interactive. You plug it in, and it'll tell you, right, if you have some implicit bias. It's an implicit bias. I think it's Harvard/implicit bias. It'll tell you in the privacy of your home, right? So you'll be able to identify and be like, oh, this is something I need to work on, right? It's not a bad thing. We all have some bias towards something. It's great to identify that that's something that you might have, right? Um, don't give up. This is not an easy thing. And especially when you see the rates happening, it's easy to get disheartened. You see, oh, there goes the link. Thank you. Implicit.harvard.edu. There it goes. Yes, that's the survey I'm talking about. I know it right up. I know the link, so that's all it. It's in the chat group. Don't get disheartened. This work is never ending. Though we would love to see an end to, opioid overdoses, we have to understand and meet people where they are. I think that's very important, is meeting people where they are. And don't be afraid to reaching out to other groups that you may think, you won't get along with.
Thank you to Kenya for sharing your insights, expertise, and practical strategies on stakeholder identification and community engagement. Your perspective highlighted the importance of collaboration, building trust, and creating meaningful partnerships that strengthen the communities we serve. To our listeners, thank you for tuning in to this episode of the DC Engage on the Go Learning Series. We hope today's conversation provided valuable tools and ideas that you can apply in your own work and communities. Be sure to join us for future episodes as we continue exploring topics related to drug user health, community engagement, overdose prevention and response activities, and building stronger systems of support. Remember, meaningful change starts with connection, collaboration, and meeting people where they are. Until next time, take care and keep building bridges.